So the next thing in my assessment of a patient when they come in for their adjustment is I've already checked the low back, I've checked the mid back, okay, or the thoracic spine. The next thing that I do is I'll go ahead and check the neck. Now, there are a couple different ways of adjusting the neck. There's actually more than a couple, but the most common ways anyway, there's two of the most common ways. And one of them is with the patient on their back, like you see here, and then we'll go through here. And again, like I mentioned in the other videos, I'll feel for heat, I'll feel for any kind of changes in the skin, because when you have changes with the nervous system, you notice things like one spot is, part of the skin is a little bit sticky or dry or something like that. So I'll feel for that, I'll feel for heat, I'll feel for muscle spasms, and like in her case, I can feel a muscle spasm right here, kind of in the lower part of her neck on the right side, okay? So I know that when you have that spasm, there's most likely some sort of nerve interference at that area. And like we talked about before, that just tells me that that's a sign there's probably a subluxation in that area. So by feeling it, by moving it back and forth, I can feel the way that the bones are moving, and I can see, or I can feel it with my hands right here, that it just doesn't want to turn this way. It doesn't want to rock to the side, and then I can also rotate it and feel that it doesn't want to turn that way, to the left. Okay, so basically it's not wanting to go this way and not wanting to turn that way. So what I'll do is I'll put my finger right on that spot, okay, right on that bone that's not wanting to move right, bend it all, bring it all the way here to the side. And these ones usually make noise, but they also don't hurt, okay, usually don't hurt. And we'll just go right here and I'll give it a quick little bump, and it makes a lot of noise. But again, the noise, like I said before, doesn't necessarily mean that the adjustment took place. But in this case, I felt the movement, she felt the movement. We know that the bone moved. Now, very important, this is very, very, very important that no one tries this if they're not trained as a chiropractor, because as anyone knows, the neck is pretty delicate. The whole spine itself is delicate. Any kind of damage that's done to the spine can be deadly, okay? So it is a very trained thing. We go through 3 years of intense training to learn how to make these specific adjustments.